Hi, I'm Greg McNeil, the founder of Cover2 Resources, and today I'd like to talk just a little bit about making a difference in the opioid epidemic. I want to start off by introducing you to my family. My oldest, Matt, my daughter, who is the first voice that you hear on the Cover2 podcast series, Amy, and my youngest son, Sam. In 2015, on this day, Mathew's wedding day, was a joyous day for us. We had a lot to celebrate, not the least of which was Sam and his progress. You see, in 2007, Sam was at a holiday party, and he got into a terrible, terrible fight, defending a young woman's honor. Ultimately, he ended up in the ER, and he was overprescribed. He got hooked on pain pills, and when the doctors no longer prescribed to him, would no longer fulfill the prescriptions, he ended up buying them on the street. For a 21-year-old, economically, at $90 a pill, that's not viable for very long. Real quickly, he ended up on heroin. We found that out in 2010, and automatically, our whole family went into crisis mode. We got Sam the help that he needed, in fact, right down the road here at IBH, and he did really well. He spent about 4 months there, came out, came back home, and we thought resumed his life. But about the 6-month mark, he relapsed. We felt as though, you know what, going locally, that didn't work. So let's send him away. So we sent him to Florida. There, he went through treatment at the Boca House, and ultimately had some stumbles afterwards, but magically, in the summer of 2015, everything came together. It was unbelievable. His life came together. He had a great job. He had a loving, loving girlfriend. And just weeks after this, we found out that they were expecting a child. So on October 23rd, 2015, the last thing in the world that we expected was to get the call. That day, a Friday, he kissed his girlfriend goodbye. She went off on a church retreat. Sam went back into the office. And then he took off the afternoon. Who knows why, but he texted his guy, and he picked up for the last time he used. We found out weeks later that the heroin that he got that day was heavily laced with fentanyl. They found him the next day. And he was gone. We were numb for quite a while, in total disbelief. And somehow, I began to think about the talks that Sam and I had as he was struggling with this disease. And Sam really wanted to make a difference. He wanted to make it help others, in fact, not go down that same path. So we decided we had to do something to make a difference. So I knew nothing about podcasts, but for whatever reason, we decided to do a podcast series. And we started off by interviewing all of those people that were involved in his care to just try and find out some answers, to try and figure this out. How the heck could this possibly have happened? I also had a chance to talk to the detective who investigated it. So I wanted to find the smoking gun. Well, there weren't any smoking guns here. What there was, however, is a lot of education. We learned a great deal. And the more we learned, the more that we wanted to learn. about everything about this disease. So we began talking to many, many people, many specialists, people such as Nicole Labor, who told us about how the brain works and the impact that this has. We learned about drug court. We learned about needle exchange. We learned so many things that we wish that we would have known when Sam was struggling with this disease. Ultimately, the Cover2 PPT podcast series, People, Places, and Things, Making a Difference, is something that we really hope that people will get the education that we wish we would have had when we were struggling through this crisis. But there's two things that I want to share with you about what we learned. Two things that this series we're hoping we can impart on others. First, recovery is it's not like it's presented in Hollywood. Recovery is the rest of your life. So as a family, we didn't realize that we had to gear up for this. We had to be prepared for not just one little rehab stint, if you will, but the rest of our lives and taking care of this. Also, we felt, for whatever reason, that recovery you should go through, you should go through rehab one time and relapse is failure. But relapse isn't failure, not at all. Relapse is actually part of recovery. Probably one of the most profound things that we learned was that with heroin addiction, the pink cloud sticks with you for a long time. You get rid of the drug out of your system physically very quickly, but your brain takes a long time to recover. In fact, more than 2 years, typically. So vigilance is critical. We also learned, and something that is very profound about this is the fact that you've got many, many different service providers that are involved in the process, the delivery process. And left on your own, people that are trying to make it in recovery, they have a tough time navigating through all of those providers. Ultimately, 35% end up dropping as it goes along. So advocacy is just a key. So a big thing that we learned, though, is that the federal government isn't going to take care of it. The thing that's going to really make the biggest difference is communities. Communities coming together to address this issue. And throughout this process and throughout these interviews, what we've learned is that there's some great things that are happening throughout our country that are making a difference. One of those we happen to find right here in our state, right in the Cincinnati area, and that was a quick response team. We noticed that last summer, in August in fact, there was an article in USA Today that talked about all of the overdoses in the Cincinnati area and how this little community outside of Cincinnati by the name of Coleraine put together this quick response team about a year before that. And the quick response team was going out into the community, knocking on doors and offering help. And it was a 3-person team consisting of police, firefighter, and social services. What happened was they had a 35% drop in overdoses, and they got 80% of the people into treatment. So we wanted to bring them back. Dan Malloy and his team, we wanted to bring them here and have them give a little workshop. And they agreed to do that. On December 10th, we gathered here and over in Green. We ended up having 75 people participate in that from 15 different communities. And I'm delighted to say that today we have more than 10 communities in Summit County that have now deployed quick response teams. And the reason is leadership. Leadership from Jerry Craig, from the Adams Board, leadership from our mayor in Green, saying, you know what, that's for us. We want to do that. Another program that I want to talk about is Drug-Free Clubs of America. But first, one thing about our youth today. All of our programs have been pretty much the same up to this point. And our youth of America having these programs whereby their one-shot deals is a struggle because within 3 days, they've forgotten the whole thing. So we have a vulnerable population there. With our kids, their brains have not fully matured until they're over 22 years old. So we really, really need to protect them in a big, big way. And if you look at this chart, you see how critical it is. We lose, if you look at it, its first use is critical here. So for those kids that start at a very young age, we're losing a third of them. What we need is we need to grow leaders. And again, the program that we learned about is Drug-Free Clubs of America. It's a program out of Cincinnati that was started 12 years ago by a couple of firefighters that were just tired of seeing the devastation that it's done in their community. And as a result, what they did was they put together a special thing that's chapters in schools to make the kids, turn the kids into leaders. The kids in the schools now, all of them, it's an optional program, they sign up for this, they agree to this, and to get into the club, they take a drug test. Once they pass the drug test, they're issued a card, and as a card-carrying member, they present that card into the community at businesses, and the businesses participate and get on board and support that, give them discounts and what have you. And here's the neat thing. In the school, the kids are the leaders. They're the ones that determine the benefits of this. So I'm proud to say that our superintendents have embraced this. We did a workshop in February, and guess what? We've got some programs that are projected to start this fall. Hudson, Cuyahoga Falls, and Greene. There's some other programs out there, many other programs, that are making a big difference that we've learned about. I don't want to go into all of those right now, but these can make a tremendous, tremendous difference. The list that we've discovered and uncovered so far and done podcasts about is more than 22 of these different programs that communities are able to start, and they're able to start them very easily and with little or no budget whatsoever. And most of these can be turned around and begun in less than a business quarter. So what we'd like to do is talk as we move forward about how we go about bringing more of these programs to Northeast Ohio and really making a difference here. So probably the most profound thing that I've learned over the course of this journey, the past 19 months here since we lost Sam, is that when you decide that you want recovery, it's like making a decision that you want to climb Mount Everest. And there's a reason why there's only 4,000 people that have been able to make that ascent successfully. And it's because there's just so much to manage. An incredible amount that you have to manage to make that happen. In fact, for just one person to make that ascent, it requires more than 13 people to surround them. And recovery is no different. There's so much to manage. And it takes a whole team to really make that ascent and change one's life. And it's ongoing. And their life depends upon it. So I'd like to conclude today by asking you all If you know someone who's struggling with substance use disorder, I'd like you to inspire them. This chip that I've got has a picture of mountain climbers on it. And the whole concept is to inspire recovery. Let them know this disease is a disease of isolation. This disease is one where we need to do away with the stigma associated with it. This is something where we need compassion. I would like to invite all of you to take a chip as you leave for intermission here, put it in your pocket. The next time that you see someone that's struggling with opioid use disorder, encourage them. Ask them, take that chip, put it in your pocket, and know I'm on your team. And that is how we make a difference in the opioid epidemic. Thank you.